All right, well, I'm Shannon Stark, the director of Clay Center Area Chamber of Commerce, and I'm so excited you guys agreed to do this and sit down with me today. We have Dana Rickley here, who is the Clay County Health Department Administrator, correct?
Yes.
Title there? Good. And Pam Kemp, who is the Clay County Management Director. And you two have been working very hard during this pandemic that our world really is going through right now. So we're just kind of here to educate the community and keep everybody informed. And I have some questions from the community from you guys today. But first, I just wanted to start with an update about, how COVID-19 is affecting our state and specifically how it's affecting Clay County.
Okay. Well, currently we have 620 cases in Kansas, and that includes 46 counties. There have been 17 deaths, and of the 446 people that were hospitalized, no, I'm misspeaking. 151 of 446 people.
Yeah, there are 151 hospitalized.
Yeah. Oh,
okay.
446 were hospitalized of the 620 cases. And so far, the state of Kansas plus other entities have tested 6,454 with only 620 positives. So we're doing pretty good with our testing rates. Clay County is one of the higher testing rates if you look at the data. The KC metro area, they have the most cases with 382. And then Northeast, which is the northeast part of the state, they have 78. Our North Central region, we only have 10 cases. And then South Central, which is like Wichita area, they have 118 cases. And Southeast has 25, the Northwest has 1, and Southwest has 6. So Northeast and Metro have the majority of all the cases.
Right. Good. So in Clay County, we still only have one case.
Yes. We had one case that was travel related, and they came back to our county on the 15th. So they completed their 14 days of quarantine, and then they were released from quarantine back on the 29th, and they completed that. And then any people that they had contact with, we were following, checking their temperatures daily, and none of them came back positive, and none of them had symptoms.
Okay. So that kind of, one of the questions that we were getting is, can you explain being in contact with people and how that kind of chain works, and at what point they need to be tested or be concerned at being in contact with someone that could have been infected with the virus?
Okay, somebody that you have close physical contact, like Pam and I, we're too close. But I haven't gone anywhere, and she hasn't gone anywhere.
Other than with each other.
Yeah. But if we were together for greater than 10 minutes at this distance, and we were face to face talking, we would be considered close contacts because we were talking face to face. I mean, we're talking. So that would be close contact. And anytime that you're with somebody greater than 10 minutes in that close proximity, you would be considered a contact if one of us was positive. So that's a contact.
So then if you are positive and Pam goes home and is living with the people in her household, do those people also need to be?
No. If she's my close contact, she needs to be in quarantine for 14 days, and she would want to monitor her symptoms. She would be looking for a fever and shortness of breath,
A cough.
and a cough. And if she developed any of those things, she would notify public health. At that time, she would have contacts, and then we would reach out to, like, Pam, who have you had contact with besides your family? And she would want to basically self-isolate, but her family would not be contacts unless she became ill, and then they become contacts. But all of her family can leave, but Pam needs to stay home. Now, if she becomes symptomatic, then she remains in isolation for 7 days or 72 hours, fever-free, fever-free, and then she's out of quarantine. But her family that was in close contact with her, their quarantine started when she became symptomatic. And so then their days would be 14 days out from there. And if they don't become symptomatic, they can leave. But Pam can leave as soon as her 7 days or 72 hours is up. But her family couldn't because they were a contact.
I think this is the most complicated thing to try to explain to lay people. And KDHE on their kdheks.gov website has excellent information, and they have it divided up into what they call toolkits. So if you go to that website, look under the toolkits, under the isolation and quarantine toolkit, there's a color-coded graphic that kind of walks you through. Yeah, Dana's going to be Dana here. So yeah. That will walk you through what Dana just explained. And for me, that visual, that helps me figure out who do we need to be concerned about if this person has that. And that's been a pretty common question that the two of us have gotten from the community and from businesses, especially if they have an employee that was in contact with somebody in another county that was a contact of somebody that was positive. Is there a concern? Yeah.
No.
And we can walk them through that then and help them figure that out. So.
Mm-hmm. And we do have staff here at the health department that can help people go through that process. We just have a set of questions that we ask, and they either say yes or no. And then based on how they answer that question, yes or no. So we can kind of help alleviate some of that concern that people have.
Yeah, no, I think that clears up a lot. I think that is a confusion of the chain of of how many contacts, and because you hear that it's so contagious that people think that they're at risk when maybe they may not be.
Right. But Pam and I, even like right now, we're not looking at one another, and we're both, I'm more at risk because she's like
behind you.
Yeah, she's behind me. So if I like snorked up all the air in front of her, I potentially would be infected.
Yeah.
But that brings me to another thing. It needs to get into your lungs. So if it goes in your mouth and you eat it, your stomach juices will kill it. You know, it's only if it's in your respiratory tract, not your mouth. So eat plenty. Yeah, eat healthy, good fruits and vegetables.
Yeah. Okay, so another question that we got is regarding the stay-at-home order, and we know that is in effect for the state of Kansas until April 19th.
Correct.
Have you heard anything, or do you feel like it's going to be extended in any way?
Yeah.
Well, you know, if you're following Dr. Norman, the Kansas Public Health Officer's press conferences that he does a couple of times a week, you've heard him talk about the curve and what his expectations were for example, for the end of March. He predicted about a week before the end of the month that by the end of the month we would have 500 cases in Kansas. And there were some people that were skeptical of that because at the time he made that prediction, we only had 100 and some cases. The end of March came, and sure enough, on the 31st of March, we had 520 some cases, if I remember correctly. And as the epidemiologists track how the disease is progressing, they use what they call a double rate. So once you reach a certain point, you can expect the case numbers to double every however many days. Right now, we're at about a 3.4, 3.5 days. Every 3 or 4 days, our numbers are going to double. Until we reach that peak, and Dr. Norman and the rest of the scientists aren't expecting that to happen until the 20-something of April.
I think April 24th.
Yeah, I think that
is
was
when they
the
thought
date
we would peak.
that they gave us. So obviously the 19th is before that. So we're not even going to be at the peak of this outbreak on the 19th. So, you know, they had to come up with a number 3 weeks ago when they put that stay-at-home in place. They picked the 19th. I think that was a smart thing to do, but I don't think people should expect to have life back to normal on April 20th. That's not going to happen. It's going to take just as long to get that disease on the downslide as it did to get up to that peak, if you follow what I'm saying there. So, you know, when we reach the peak, whenever that is, we're going to have another period of time making sure that we're into the safe zone before we really start wanting people to move around freely in the community. So that's going to stretch it out. And that is, I think, why the governor, I can't speak for her obviously, but logically thinking, I would expect that that's why she just went ahead and ended school for the whole semester. Because looking at how epidemics happen and how that ebb and flow works, it was not going to, there was not going to be, you know, a place where realistically we were going to be able to get kids back into school. So that brought us to where we are. And the stay at home, you know, Dr. Norman talks about if even an extra 35 or 45% of the people would follow the stay at home directions, it can flatten that curve a little bit so that that peak comes at a lower number than it would be, and therefore quicker. So
Yeah, and that way it wouldn't overflow or overburden our healthcare system, which is what we're trying to protect right now with the stay at home.
Right.
So I guess the long, complicated answer to your short question was, I don't think that any of us that have been working this incident really expect the stay-at-home condition to be over with on April 19th. Don't know yet what it's going to migrate to, but I don't think that we'll be able to completely lift that by April 19th.
So people should be prepared for it to be extended. Yeah, no, that was all very, very good information.
Yeah, that's the best advice we have.
Yeah. Okay, so next question when it comes to traveling within Kansas versus traveling out of state. So we had someone email in that their daughter was supposed to travel in and be home for the summer, and she would be traveling in May. So is that something that's probably not going to be able to happen? And maybe kind of just touch on, you know, recommendations traveling within Kansas and recommendations versus like traveling out of state and what you guys are seeing.
Well, currently in the state, there are no travel restrictions, although you would want to pay attention to the communities that they're coming from to know, and maybe they would know if they had been a contact of a contact. Who knows? But currently there are no travel restrictions in the state of Kansas. And if a person is coming from a state that has been deemed community spread, then when they get to Kansas, we would want them to quarantine for 14 days to assure that they weren't infected when they came here, just to protect the rest of the people that are in our community.
And I'm gonna add to that really quick. On the KDHE website, they have really good material on what areas you're traveling to that are considered community spread, in which you need to quarantine when you come back.
Yeah. They just added Connecticut today.
Yeah.
So the most recent ones are Illinois, Wisconsin, and
Louisiana, and Florida,
Mhm.
and now Connecticut. So, without knowing specifically where
Oh,
this woman's
California.
daughter is located, for example, I'm supposed to go. I've got reservations in northern Wyoming with my family in late May for a family graduation up there. I haven't canceled those yet, but every day that goes by, I feel like, oh, I should probably do that, but I just haven't done it yet. So the reality is I'm probably not going to be able to make that trip at the end of May.
Are you going through Colorado?
Well, you kind of almost have to either Colorado or Nebraska, and Colorado's on the list, Nebraska's not. So so people just have to be flexible, and it's almost a day by day type of situation right now. I mean, I can't tell you how many times we've been just clicking along on a day, doing our planning and everything, and then all of a sudden here's a news bulletin and something changes and we have to do something over because it changes. It's just moving really quickly, and it's going to continue to do that.
Good. Okay. So next question. I've heard the only test, as in doctors, only test under certain circumstances. Is it necessary to go to the doctor if I won't get tested anyway?
Well, that's kind of a hard question. Typically, the doctor is going to test you if you're showing signs and symptoms of COVID-19, which would be the shortness of breath, and a fever, and or a cough. And then some people have had other symptoms also. But if you have those symptoms, then they would test you for COVID. If it's already community spread, most likely they would just tell you to go home, take care of yourself, and call me if you feel like you need to be seen. But otherwise, they're just going to have you stay at home and be fever-free for 72 hours or 7 days. But once there's community spread, there's really not a reason to do testing.
And even right now, before they do the COVID-19 test, they will test you for influenza and a regular, what they call a respiratory panel that checks for other common respiratory illnesses. And they won't do a COVID test unless those all come back negative.
Mm-hmm.
And depending on where you're at, for example, Johnson County right now, even if you have a negative flu and a negative respiratory
mm-hmm.
panel, they won't do the COVID test unless you're sick enough that you're going to be hospitalized, so that they know for sure what they're treating. Again, as Dana said, they have community spread. They know that, if you don't have the flu and you don't have one of the other common respiratory diseases, it's more than likely the COVID-19. So they're just not doing that test.
Mm-hmm. And also, when you think about it, right now we're in the high season for allergies. So if this is your typical allergy season symptoms, it's probably your allergies, especially if you haven't traveled to any of those high-risk areas and you haven't been notified by public health that you are a close contact to a positive case.
And without a fever.
Yeah, and without a fever.
Say it's allergies.
Mm-hmm.
And you asked about, should you go to the doctor with those? And our advice always is call first.
Mm-hmm.
Call your primary care physician and ask what they want you to do. Give them your symptoms. They'll ask you some different questions than you've been asked before, because they'll do the screening for the travel related and, ask you about your contacts and that type of thing. And they may or may not even want you to come into the clinic to be tested. So,
and right now I think they're doing kind of like a drive-through. If you call and schedule your appointment to be tested for COVID, because if the doctor deems that you should be tested, they will meet you in the old ambulance bay and do it there, so you don't even have to get out of your vehicle.
And again, the whole goal of everything that we're doing is trying to keep people apart. You know, so by doing it that way, they're not bringing you into the waiting room, so you're not being exposed to anything in there, and the people in there aren't being exposed to you. So, you know, a lot of the questions that we get answered about, can I do this, or can I do that, or should I do this, or should I do that? That's what it comes down to, is that going to bring you in contact with non-household members? If the answer is yes, then you shouldn't do it, because that's how this disease is spread.
And we really need to be careful and mindful of the health and safety of our grocery store workers and our convenience store workers and people that are deemed essential, because they're working, providing a service for us as town people, and we need to be respectful of that and try to do the social distancing when we are out in public, and only going to the grocery store for essential shopping and only buying the essentials. And like when you're going to the hardware store, don't just go there to browse, go there with purpose, get your business done and get back home. Same way with grocery shopping. Go there with a purpose, purchase your items, pay for it, and leave.
And it doesn't need to be a family outing.
Right.
It should be one member of the household that makes those essential errands, and they need to be limited to essential errands.
Now, there's a lot of shopping you can do online. Today, Hobby Lobby is closing across the state. I think today they decided that as a company to go ahead and do that.
And I saw a news thing from Target where Target is limiting the number of people that they allow in their store, starting sometime in the next day or so. Menards has closed all their stores to anyone under the age of, I think it's 16. And again, it defeats the purpose of the stay-at-home order if you load the whole family in the car and go wandering around a store.
Because you're bored.
Yeah.
Yeah, it can't be a family outing. And I know a lot of our local businesses have made changes where you can
Call ahead.
Call in and get the curbside and things like that. So good. Okay, well, talking about businesses, I know that you guys have had a lot of questions when it comes to the what is essential business, and again, the KDHE has some information on their website about that. But is there anything that you feel like the community needs to know when it comes to I mean, I guess I feel like you kind of just covered that with the not making it a family affair and you know, doing essential shopping only.
We were getting a lot of questions from people that would see a business open and think, well, that's not something that we have to live. Why is that essential? And so they would, you know, complain about that. And that's totally transparent and open to the public. You can get on that KDHE website and look at those essential business. They're called essential functions. And they follow what's called the Kansas Essential Functions Framework. And if a business, you know, household maintenance types of things like carpenters or plumbers or air conditioner or furnace people, those types of things, those are essential businesses, because you have to be able to make those types of repairs in your home in order to live safely. So they fall under that. There are very few of the businesses in our county that don't fall under one of the essential functions. That's part of the reason we didn't do a countywide stay-at-home order. We don't have an abundance of businesses that fall outside of that, like Manhattan does, and Riley County did their own stay-at-home order. So, you know, in looking at what was going to serve our community best, it's just trying to educate people about what we're asking them to do, which is just stay away from other people, unless you absolutely have to perform a task or make a purchase.
And if you do happen to have a tradesman come to your house to do a repair, stay your distance, and when they leave, clean up where they've been. You know, that's what we're asking
And
people to do.
if you're a business person that has to go into other homes, into other people's homes to do plumbing work or whatever utility or type of work you would have to do, there's guidance on the KDHE website to help you screen that call when you take the call for service. Screen that call, ask the questions that you need to know, and make the decision then whether or not you're risking exposure by going to do the work in that house. So they updated that guidance just a couple of days ago. They've all kind of run together. I can't tell you the date, but so if a tradesman had downloaded that a week and a half or so ago, go back and look at it again. It's been updated. So.
Good to know. Well, is there anything else that you feel like you want to inform the community about? We're going to have links on our Facebook page to the KDHE website, because I know we referred to that a lot during this video. And I advise anyone in the community to go out on that website and just spend some time. It's updated daily. There's a COVID resource center on there and all kinds of documents and things just to keep you informed and keep you up to date. It's a great tool. You guys also have set up COVID-19 at claycountykansas.org
Yes.
to email.
That's an email address here to the health department, and we have somebody monitoring that Monday through Friday. So they respond almost immediately when we get inquiries on that line. And if we don't have an answer at that time, we say we don't have an answer. And then when we do get an answer, we return that email. And then we also, if we hear something later, we will also contact that person to give them the updated information if something had changed since we had corresponded.
And don't forget the volunteer registry that you set up for us at the chamber office, where people that have one of the conditions that makes them nervous to go out and do their own errands can register for help, and as well as people that are under 60 and don't fall into any of the risk areas can go onto your website and volunteer to go get groceries, pharmacy, whatever those folks
do
need.
that essential shopping for people.
And that's a very
And I will say, so claycenterchamber.com. So just, even if you just Google Clay Center Chamber, it should pop up. And it says happening now, and you can go to that COVID-19 volunteer program. We have plenty of volunteers. If you would like to volunteer, you're more than welcome to still sign up. But really reach out if you're in need, or try to connect us with somebody in need. And they can always call our office too. It's just 632-5674, and we'll get them connected with a volunteer. And I put on our Facebook page yesterday, even if you're a mom home with 3 young children that you can't get to the grocery store with, we don't want to have all 4 of you in the grocery store. Our goal is to limit the amount of people out running errands. So even if you just need help in a way like that, you don't have to be over 60 or high risk. Definitely reach out to us. So we're here to help. So
very appreciative of you taking that volunteer registry over, because that can get overwhelming fast.
Yeah. In my business, emergency management, that horde of volunteers in any disaster, we refer to that as the disaster after the disaster, just because it can be so overwhelming for a community to try to keep that organized and keep everybody involved safe. And so we really do appreciate that. And I have to tell you, I have shared that how you jumped in and did that for us with the rest of the state, and there are several communities that have done similar things based on what you did, Shannon. So we appreciate your leadership in that. So
good. It's been refreshing to hear the success stories from it too. People call back and they're just so thankful. So it's been a good thing for our community. So anything else that you feel like we need to inform them about, and we're about out of time here.
Stay home when you can, wash your hands, clean and sanitize the high contact areas that you come in contact to. And if you've been out in the public, the first thing you want to do is wash your hands and
Change your clothes when you come back from the grocery store, those types of things. Just anything you can do to minimize the spread.
Yeah. And if you're sick, stay home.
And this is, I'm afraid, not going to be over on April 19th. So people need to start mentally preparing for the fact that that's not going to be the release date when everything's back to normal. We've got more work to do, and we'll get there. Our community, I think, overall is doing good.
Should I?
Yeah. Good.
I talk about that
If you want.
There's supposed to be coming out a new executive order later today that clarifies more things like what is allowed and what's not allowed, but they are going to call out churches for only a maximum of 10 people total. Golf courses, only one person per cart, and no clubhouse privileges. And then no self-service at convenience stores or restaurants. So our fountain drinks will be shut down probably tomorrow, if not tonight. So that'll be an executive order coming from the governor. And I don't know, I haven't seen an email since we've been on the phone, but that's supposed to be coming out tonight.
And those are all based on clarifications that we've pushed up from the jurisdictions as special circumstances, have come up. So
Good.
From the governor's office, the attorney, he's like, I didn't realize fountain pop was such a hot topic.
It's like for days on end, we discussed turkey hunting.
Yeah.
The turkey season was starting, and apparently there are thousands and thousands of out-of-state hunters that usually come to Kansas for turkey hunting, and the question kept coming up, what about those people coming in? And so they finally decided, yes, they did have to be quarantined if they came from that list of states. And so they figured out a way to solve that, and we thought we were finished being obsessed with one topic, and then the soda fountain thing came up. So
yeah. And Parks and Wildlife, they did refund
the license fees. They contacted all the out-of-state hunters and told them that if they were coming from those specific areas, they would have to be quarantined when they got here for 14 days before they could go hunt. So
and they also can't stay in a lodge, so they would have to be in individual motel rooms, and then for their food they would have to eat it in the room. So it kind of defeats the purpose of having a hunt.
Having a hunting trip, so
yeah. Economically, this is very, very devastating to our whole state, to our whole nation. So we have to make the best of it. And I think the Department of Labor is doing all they can with unemployment,
Commerce
and Department of Commerce.
And if people have not, if they have had their hours cut or been laid off or furloughed because of COVID, they need to get on the Department of Labor website and
apply for that funding.
Apply for that. They've I don't know the word to use, but basically instead of having to wait for a week to get unemployment, you can get it immediately if you're eligible because of COVID. So there's help out there. There's supposed to be stimulus checks coming. Don't fall for the scams. It will come to you the way your income tax comes to you, whether it goes direct deposit or whether it's a check.
Yeah, do not give anybody your bank number.
Right. So unfortunately, there's predatory people out there already
Did you say
trying to.
11 that you were aware of?
I think the thing that
29.
I pushed it out on my emergency management Facebook page, and I think there's like 19 different frauds that have become pretty common around this whole COVID thing. So
yeah, definitely be aware of that and on high alert for that. So
okay.
Well, thank you guys for sitting down with me. We really appreciate it, and hopefully the community gets a lot of information out of this. I know I did, and don't forget they have the COVID-19 at claycountykansas.org email in place. If you do have any questions, you can always submit them there.
Okay, thank you.
Thank you.